Hello, my name is Sydney Wilson, and I will be demonstrating primary IV with IV piggyback medication administration. Normally, in a hospital setting, I would be standing, but for today's video purposes, I will be sitting to show a better view. I will first check my provider's orders. Patient name, Ellen Davis. Date of birth, 9/19/1965. No known allergies. First medication, sodium chloride 500 ml, infused 125 ml per hour via IV to be administered via gravity using 15 drops per ml tubing to be administered now. I've done the math and she will receive 31 drops per minute. Second medication, IV piggyback, cefazolin 1 gram and 50 ml sodium chloride over 30 minutes via gravity using 15 drop per ml tubing. The drop per minute I've calculated is 25 and to be administered now. I have my supplies in front of me: hand sanitizer, clean gloves, IV site, trash receptacle, alcohol swabs, secondary tubing, primary tubing, and my 2 medications. Normally in a hospital setting, the tubing and medications would be sealed, but I have opened them during practice, and these are the only ones that I have left. I will now sanitize my hands. I will take the first medication, sodium chloride, 500 mLs. I'm inspecting for particles. Expiration date December of 2024. I will now compare the medication to my MAR. Sodium chloride, 500 mLs, infuse 125 ml per hour via IV to be administered via gravity using 15 drops per ml tubing. Sodium chloride, 500 mLs, expires December of 2024. And there's no particles or discoloration noted. I have my primary tubing here, and I will spike the bag. Okay, I will hang the bag here. I will prime the line and clear it of air bubbles, also using Clean Technique with the cap. Okay, the line is cleared of air bubbles. And I will now check the order again. Sodium chloride, 500 mLs, infuse 125 ml per hour via IV to be administered via gravity using 15 drop per ml tubing to be administered now. Sodium chloride, 500 mLs, expiration date December of 2021. Sanitize my hands. I will now pick up my second medication, cefazolin, and 50 mLs of sodium chloride. Expiration date July of 2024. Normally this would be in a sealed bag. Compare it to my MAR. IV piggyback cefazolin 1 gram in 50 ml sodium chloride over 30 minutes via gravity using 15 drop per ml tubing. And sodium cefazolin 1 gram in 50 mLs of sodium chloride. Expiration date July of 2024. I will now take my secondary tubing and spike the bag. I will hang the bag here. Using Clean Technique with the cap, I will prime the line. Just making sure there's no air bubbles, being very careful as there's only a little medication here. Okay. All right, and now I will do my second check. IV piggyback, cefazolin, 1 gram in 50 ml sodium chloride over 30 minutes via gravity using 15 drop per ml tubing. Cefazolin, 1 gram in 50 ml of sodium chloride, expiration date July of 2022. Sanitize my hands. I will now greet my patient. Hello, Miss Davis. How are you doing today? My name is Sydney. I'll be your nurse. I will be administering your IV medications. Could I have your name and date of birth? All right, thank you. Patient name, Ellen Davis. Date of birth, 9/19/1965. No known allergies. I will compare to the patient's wristband. Ellen Davis, date of birth, 9/19/1965. No known allergies. I will now... Oh, I'm sorry. I would have sanitized my hands. I will now sanitize my hands. And don clean gloves to check the IV site. Is there any... I will check for any redness, edema. Is there any pain, Mrs. Davis? No. IV site looks okay. Okay. Sanitize my hands. All right. I will now check my first medication. Sodium chloride, 500 ml, infuse 125 ml per hour via IV to be administered via gravity using 15 drop per ml tubing, and my drops per minute are 31. Sodium chloride, 500 ml, expiration date December of 2021. All right, I will now sanitize my hands. Don clean gloves. I will scrub my IV site, and for the sake of time purposes, I will just say I scrubbed for 30 minutes. I will take my secondary IV and connect to the IV. Okay. Oops. Sorry, let's pretend that didn't happen. Let's connect it to the IV. So now I will prime for 31 drops per minute, and starting now. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30, 31. Okay, 31 drops per minute. And that's all set. Take off my gloves, sanitize, compare the medication order again. Sodium chloride, 500 mLs, infuse 125 ml per hour via IV to be administered via gravity using 15 drop per ml tubing, drop per minute 31. Sodium chloride, 500 mLs, expiration date December of 2024. Sanitize my hands. I will check my IV site for any redness or edema. Any pain, Miss Davis? Okay, no redness or edema. All right, pretend that one. Pretend these two are clean. I will next check my secondary order. IV piggyback, cefazolin, 1 gram and 50 ml sodium chloride over 30 minutes via gravity using 15 drops per ml tubing, drop per minute 25. Sodium chloride, or cefazolin, 1 gram, sodium chloride in 50 mLs. Expiration date July of 2024. I will sanitize my hands. Don clean gloves. Attach my secondary tubing to my Y site. Scrub the Y site port for several minutes. For 30 seconds. For time's purposes, we'll pretend we scrub for 30 seconds. Okay, connected to the port. I will open up my secondary line completely, and I will use my primary line but first I will, before I open up my primary line, I will set for 25 drops per minute, starting now. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, and 25. All right, that's all set. My secondary line is open, and I've checked. I will pretend these are clean gloves. First sanitizing my hands, clean gloves. Assess my IV site. No redness or edema, any pain? Nope. All right. I will now Finish and document.